Good morning, dear students. In the last few presentations, you have developed an idea how the bones develop in your body to form the skeleton. Now, in any of your institution you are getting admission to, the gross anatomy part will start with the demonstration of the different bones as a part of the skeletal system. So, before studying any of the bone, some bone surface features known as the bony markings you have to know, because these are common to every areas, every bones, and repeated times why this area of the bone is called so will not be said to you, because gradually the term on repeated hearing you will get in your memory. So today's presentation is about some of the anatomical terms of the bony markings. By this time, you have already been informed about the positions, different planes of dissection, and the preliminary part of the dissection class, you have to handle the dry bones. In most of the institutions, you are getting admission to any of the extremities, mainly superior or inferior extremities, usually started as the first topic of your gross anatomy in dissection. So we have decided to start the superior extremity as the initial part of the dissection in our presentations. So to start with, before that, you have to understand what the bony markings mean and how they are called so, why they are called so. Now, this presentation deals with the terminologies related to bones and their surface features. While handling the bones, you will see that different bones are different type in shape. There are some similarities, so they are classified. So, coming to the surface features of the bones, and the terms are mainly the surface features of the bones develop due to attachment of the muscle, their tendon, and because of the pull of those muscles following movements, these projections, these prominences onto the surface of the bones appear. They are also created because of close lying of some structure onto the surface of any bones or the structure passing through it. So these are the mainly reasons for which the bony markings, that is the surface features of the bones, are created. And about the bony markings, you must have to remember that these are common features. So if I will name a feature to be named as that feature, that will be universal to that sort of features in all bones. Understood? So it is applicable to all bones and simulating to same sort of features even in some soft tissues lying in other regions. The bony markings are mainly of two types. One is known as projections that grow out from the bone. From the bone surface, some bony elevations are created. And some depressions, depending on their shape, location, their name are variable, but mainly they are depressions. They are known as cavities, sulcus, fissures, and all. I'm coming to. So, in the layman term, while feeling a bone surface, apart from the general terms of, if we are saying of the long bones, so it has ends, at least two ends. It has one surface, some borders that you can feel onto the surface, some elevations onto the surface, some depressions, some grooves, ridges. These sort of features have some specific names, and these names are known as the bony markings. And you know by this time the parts of any growing long bone, any of the long bone having two end, one upper and one lower end, and an intermediate shaft known as the diaphysis. Onto the end, it is lying the epiphysis, then epiphyseal cartilage, and metaphysis. At the end, the bone articulating with the other bone to form the joint. So that surface via which it takes participation in the formation of the joints are known as the articular surface. The term physis means growth, epi means above, so epiphysis. Meta means behind, that is behind epiphysis is the metaphysis. And this dia means between two ends via across the line. Part of the long bone is the diaphysis. These are some of the other long bones lying in your extremity, mainly the superior extremity. Onto the arm, the typical long bone is the humerus. Onto the forearm, these are the two bones. The lateral one is the radius. The medial one is the ulna. This is the ulna and this is the radius. Now to know about some bony markings, grossly they are classified in the form of projection and openings or depressions. So some projection names are tubercle, tuberosities, trochanter, condyle, epicondyle, process, protuberance, crest and ridges, spine, linea, facet. To say about opening and depressions, they are named as foramen or fissure, meatus, fossa and fovea, incisura sulcus, sinus. What are they? With example, I will explain. First, the term that is under the heading of the projections. We will proceed now with the projections called, that is known as the tubercle. It's a Latin one. Tuber means bumps or swelling. Anywhere, any elevation, small in size, lying onto the surface of the bone is known as a tubercle. That is universal, applicable to any of the bones if such feature is present onto the surface of any bone. So tubercle is small, rounded elevation, such as this is a rib. Onto the posterior part of the rib, there is a elevation. Nearer to the part that is known as the neck of the rib, after that, this region of small bony elevation known as tubercle. This sort of features you will get in other bones also. The next feature, a little bit more in size, the projection is known as tuberosity. Again, it's a Latin word, tuber from the same word, meaning bumps or swelling. And this time the swelling is little larger than the tubercle, such as one bigger and one smaller bony elevations lying onto the upper end of the humerus. They are medium in size, and when two are present, one of them is larger than the other one. So these are the tuberosities. One is greater tuberosity and the smaller one is lesser tuberosity. Now again, even more larger bony mass rounded onto the surface of the bone, more in size than tubercle and tuberosities. So another larger tuberosity is trochanter. This is a Greek term, first coined by Galen, and trochos means wheels, such as here you have one large surface elevation. In case of femur, upper end, we have two such. So one is greater trochanter and one is lesser trochanter. Next bony marking is known as the condyle. Condyle again a Latin word. Condylus means knuckle or knob. It is rounded prominence at the end of the bone that articulates with the fossa of the another. You can see it is the mandible, the only mobile bone of the skull. Onto its one end, there is a rounded area. Whenever it is rounded to articulate with the corresponding part to form the joint, the corresponding part must have to be a depressed area. So the rounded part of any bone articulating with the fossa to form the joint. So that rounded part is named as the condyle. Same way, you can see at the lower end of the femur, these are the two condyle. One placed medially, so this is medial condyle. One placed laterally, so this is lateral condyles. These are the two rounded surfaces at the end, takes part to form the knee joint. Now the term is very related. The epicondyle to condyle. Epi means above or on or upon, as such as in epiphysis, you have known the term. So any bony elevation lying position-wise above the condyle, it is known as epicondyle. It is again a Latin origin word, having coming from the condylus word, rounded prominence above the condyle. So you can see this is the lower end of the femur having the two condyles and two bony elevation above the condyle. They are known as the epicondyles. Again, location wise, one is above medial condyle, so it is medial epicondyle. One is above lateral condyle, so it is lateral epicondyle. Now, the bony marking terminologies in the underheading of the projections, we will get some processes, protuberance, and crest. The term process are the self-like projection from the surface of the bone, such as in ulna. One elevation as if the bone at the upper part is being pulled up, above, and one in front. So there are formation of two processes. One is the olecranon process. Why it is olecranon, I will explain. And one is the coronoid process. Why they are named so, I will explain in the consequent bone. But you know the surface features that they are shelf-like processes growing from the surface and coming outwards. So these are the two examples of the processes. Protuberance are thick localized projection onto the surface of the bone, and crest are linear projection. Linear having some length onto the surface of the bones. See, this is the mandible, and onto anterior part of which there is a prominence. Mandible is developing in two halves. The two halves meet anteriorly to form the prominence of your chin or the mentum. So that prominence is known as the mental prominence. Again, to see this bone, this is the hip bone, one-sided. And the hip bone individually is formed by union of the three separate bones. The upper, this is fan-shaped bone, is known as the ilium. And onto the upper part of the ilium, there is a elevated ridge-like linear area. Okay, that sort of feature is known as the crest. Here it is in relation to the ilium bone, so it is iliac crest. Again, to say about the depressions. Depressions lying onto the surface of the bone, they are mainly produced by any of the structure passing in close proximity to the bone, rather to the developing bone, and they are creating pressure onto the surface to form the depressions. It is localized small linear depression. Groove or sulcus means like trench, furrow, linear depression on the surface. Sulcus is shallow than the groove, must remember. The sulcus is less in depth than the groove. So this is the upper end of the humerus. One such example of the sulcus is lying between the two tuberosities. By this time, you know the name. This is greater tuberosity. This is lesser tuberosity. And in between these two, there is a sulcus known as the bicipital groove. The groove having to lip onto its either side. So it is bicipital groove. This term sulcus you will get in soft tissues also. So also in somewhere in heart. This is a picture of the brain. See, onto the surface of the brain, you can see some of the areas are depressed, some of the areas are elevated. The elevated areas are known as gyrus, and these depressed areas are known as sulcus. The same way like that of your bony features. But in bones, we do encounter two separate things. One is groove and one is sulcus. Difference is been explained in depth only. Next is fossa. Fossa means ditch. It's a Latin origin word. It means shallow depression. The shallow depression may be small or big on the surface of the bones. See such example. This is one of the hip bones, and onto the ilium, onto its anterior surface, there is a depressed area. So that is a fossa. And that fossa related to ilium. So this is iliac fossa. Now, some other bony markings such as spine and facets. Again, in the form of the projection. Spine is pointed linear projection, such as this is an example of a vertebra, of the thoracic vertebra. And one of the prominent linear projection is projecting onto back. This is spine. Two processes proceeding onto lateral side transversely. So these are the transverse processes, and one forming the spine. So this is spinous process. Facet are the articular surfaces on the surface of the bone, which are relatively smoother than the other. See, this is a vertebra and it articulates with the consequent other vertebrae. So also in the thoracic region with the ribs. So these are the some small areas here, 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 here you can see which articulating with the surrounding bones, either maybe ribs or the other vertebrae. So these articulating surface, small, flat, are known as the facets. This is another term to say about the spine, which is a linear elevation from the surface of the bone. So this is the spine of the scapula. This is the location of the scapula onto your back. Now to say about some of the depressions. One fossa has been said already, and these are some more: foramens and fissure. Foramens are the holes, many lying at the base of the skull. The brain is lying inside the cranial cavity, and the 12 pairs of the cranial nerves, they're coming out somehow out of this cranial cavity outside to supply the structures they are meant to. So these 12 pairs of the cranial nerves are coming out along with the consequent some vessels, nerves, other nerves, and other structures from outside of the cavity through small openings. These are known as the foramens. Okay. And fissure, if the opening is not a small circular or oval, but it is linear and having some length, as if multiple foramens has been fused with one another, such as this is the orbit, and inside the orbit on its posterior part, there is one such linear through which multiple structures are passed. Similar fissure is here also. So in respect to the orbit, this is superior orbital fissure and this is inferior orbital fissure. Again, the foramen term in case of long bones, we have already said in the process of chondrification to ossification. There is establishment of the vascularity to the cartilaginous model, and through the area onto the periosteum, the vessel is entering the cartilaginous model. That is the future nutrient artery. So in the surface of the long bones, you will find one or even more than one such openings for the entry of the nutrient arteries. So these foramens are named as nutrient foramen. And even if you'll pass a probe through it, you can delineate the direction of the nutrient foramen. As we have understood, in case of fusion of the epiphysis, by the law, to the elbow I go, and from the knee I flee. So the direction of the nutrient arteries, you can correlate with the surface features of the long bones also. And these are the nutrient foramens. Now to say about some meatus, fossa, fovea, and sinus. Meatus are the passage or the opening to something. Fossa and fovea or pit are the small circular depression on the surface of the bone. And sinus are the mainly features of the pneumatic bones. When the pneumatic meaning to air, so air containing bone is pneumatic bone, but in living life, the bone and the cavity cannot lie as it is or dried up. When this bony cavity is covered with mucous membrane, is known as sinus. So there are lots of sinuses in relationship of your nose by the side of, so they are known as paranasal sinuses. This is an example of fovea lying at the upper end or the head of the femur, giving attachment to a ligament. So this is a circular depression on the head of the femur known as a fovea. And this is the presentation of the lateral wall of nose. You can see multiple shelf-like projections. These are the conchae. And under cover of the conchae, there are lots of foramens or meatuses through which the paranasal sinuses open somewhere inside the nasal cavities. One such paranasal sinus is frontal sinus lying in the frontal bone. So frontal bone is a pneumatic bone. One of the sinuses lying in the sphenoid body. Again, sphenoid is a pneumatic bone. And these are the other paranasal sinuses, frontal, maxillary, ethmoidal sinuses. Okay, so air containing cavity in living life covered with mucous membrane known as the sinus. And their opening inside anywhere in the nasal cavity are known as meatuses. So that much for today's presentation. Revise it repeatedly. The name of the bony markings, because these sometimes any of them can come as short note also. And you will require this in study of each and every bones. And once a name is established to a bone, it is remaining lifelong. In the next presentation, we will come with a little bit study about the joints. So till then, thank you. Happy learning.